I'll be talking about Priyanka Chopra's rhinoplasty today. As we all know, Priyanka Chopra, a former Miss World, an actor, a producer, a social worker, and a philanthropist, who was born on 1982, July 18 in India. She became Miss World in 2000 at the age of 18 and made a debut in 2002 in the movie Thamijan. She was only 20 then. Her Bollywood debut movie Hero was released a year after. Her career took off from the movie Andaz, which was also released in the same year, where she played a negative role. This was the same movie with Lara Dutta, who won Miss Universe in 2000 as well. Since then, Priyanka Chopra played in about a total of 50 movies with streaks of flops and hits, including some biopics. She has proved her acting prowess in various non-conventional movies. Besides, Priyanka has also had a musical career. She released her single In My City featuring William in 2012. Her music video in collaboration with the rapper Pitbull and Exotic was debuted at number 44 on Billboard. She has also won several reputable awards, including Padma Shri Award for her contribution to the Indian cinema. It is the fourth highest civilian honor one can receive in India. In 2015, she made her American TV acting debut on ABC drama Quantico, which rose her to fame again, claiming her People's Choice Awards twice. She was ranked one of the highest paid television actresses by Forbes magazine. Came 2016, Priyanka Chopra was featured on Times magazine as one of the most influential people of the world. Since then, she has played alongside Dwayne Johnson, Rebel Wilson, and has also starred in Netflix series. She is now a brand ambassador for several companies. She married American actor-singer Nick Jonas in 2018 at Jodhpur, India. Her extravagant wedding ceremony was the talk of the town. Also, as Global UNICEF Goodwill brand ambassador, she visited Ethiopia to meet refugees. Here are some of the beautiful pictures of her visit to Ethiopia to see refugee children. Well applauded for her beauty, talent, and her sense of style, Priyanka Chopra emerged number 2 on a poll for the world's most beautiful women in 2017. Here we have Priyanka Chopra doing her photoshoot for Miss India. She had a mesoproscopic face shape with beautiful almond-shaped eyes, a mezzorine nose that is less projected with a rounded tip, also beautiful full lips with a gummy smile, and high cheekbones, which are typical facial features of women from certain parts of northern India. Look at her luscious dark hair. It is beautiful. Also looks like she has dark brown eyes. She regularly wears contacts, so it is a bit hard to tell sometimes. For this video, I'll be focusing on her nose surgery or rhinoplasty. When I was preparing this video about 5 years ago, Priyanka Chopra hadn't admitted to having a nose job. But it is different now. I do understand that the unbelievable beauty standard of the entertainment industry can put so much pressure on the celebrities. Every human being has his or her own unique beauty. A nose centrally plays a big role in a human face. Hence, a millimeter of change makes quite a difference. Her nose has a convex dorsum or the bridge, bulbous nose tip with flaring alar or the nostrils. She appears to have a significant amount of nose widening when she smiles. This image was taken when she returned after winning the Miss World crown, and this screenshot is from the music video in 2002. Here we have PC after her fresh rhinoplasty. Let's compare her picture from 2000 and 2003. You can see how her nose after the surgery, it looks wider. She now has a hanging columella with excessive nostril saw. She ended up with a bottom-heavy nose. There is also a scar on the bridge of the nose. Here is another screenshot from her movie. Now comparing again her before and after pictures from an oblique profile. You can clearly see the hanging columella I'm talking about. Here are more images for comparison. When dividing the face into vertical fifth, the nostril base distance should be equivalent to the intercanthal distance. Intercanthal distance is the width between the inner corners of the eyes. It can extend 1 millimeter wide in Caucasian, but can be wider in African American or ethnic noses. Nostrils are 30 to 45 degrees medially inclined to the vertical axis of columella and should have 2 to 4 millimeter columellar show laterally. The nostril rim and columella are ideally arranged in the shape of seagull in flight. The nasal base consists of the static and dynamic components. The static anatomy includes bones, cartilages, and ligaments, while the dynamic anatomy refers to the muscles. This provides the nose an ability to move with respiration and facial expression. Let's look at the alar flare and the alar base width before considering the alar base modification. The alar flare is the most lateral projection of the alar rim, while the alar base width is the distance between two alar creases. The alar base modification is usually considered when the alar base width exceeds the intercanthal space. Alarplasty or nostril reduction is a procedure to reduce the alar base width and the nostril flaring by removing the tissue waste at the alar base. There are different techniques of alar base reduction. These techniques really depend on the anatomy of the patient's nostril, his or her aesthetic outcome desire, and the need to hide the scars from the previous surgery. The most important thing to consider is the patient's ethnicity. In this image, you can see how Priyanka Chopra's nostrils exceed the intercanthal distance. She has inverted nostril axis and also a significant amount of alar flare, which is why I believe she might have had alarplasty or nostril reduction. These are some of the techniques by which a nostril can be narrowed: nasal cell excision, Weir excision, combination technique, and VY advancement technique. For your reference, these are the different types of nostrils. I'll explain in detail about alarplasty or nostril reduction on my upcoming video, so stay tuned guys. Here you can see that PC has had alarplasty done. Look at the scarring. Also, the alar flare has decreased significantly. In my opinion, she had a combination of Weir and seal excision to narrow her nostrils and reduce the alar base width. In this image, you can see what I meant by a bottom-heavy nose and a hanging columella. Her nose was a classic example of polybic deformity. Polybic deformity is one of the complications of rhinoplasty. This is how her nose looked like from the oblique profile. This is the oblique profile before the surgery. Here are the key features of polybic deformity: low radix, dorsal hump, supratip fullness, over-projected tip, alar notching, and hanging columella. Priyanka Chopra in 2000. Let's look at her original profile. She had a hump on her nose. Polybic deformity seems to be an exaggerated version of her original nose. Here is a screenshot from her movie where you can see a polybic deformity. It is very tricky to see a side profile of PC as she used to strategically take shots from the angle that would hide her nose job. Here is a before and after image from my Instagram. You can see how her nose bridge has been augmented. The hump blends with the augmented radix to form a bulky nose bridge. The retracted nostrils have been brought down and the tip has been rotated. Let's talk about augmentation graft. This is a very interesting case of augmentation graft. As you can see, Priyanka Chopra has had a dorsal augmentation. This kind of reconstructive rhinoplasty provides support to the areas deficient of the materials to build the nasal structure. Thus improves the contour and respiration as well in some cases. There are different types of materials to choose from when choosing a graft for augmentation. These are alloplast or synthetic implants, homologous grafts or homografts, and autologous grafts, also called as autogenous grafts or autografts. Alloplasts are synthetic implants such as silicone, Gore-Tex, Medpor, and fillers, or allogenous materials. It can provide an aesthetically pleasing look, but with a greater risk of implant rejection by body, infection, and extrusion. The homologous materials are the grafts derived from the cadavers or corpse in the other word. Though stable and yields a superb aesthetic result, there is a risk of transmission of human pathogens, as well as the chances of reabsorption of the grafts are always present, though minimal, causing irregularities in the contour later on. Finally, the autologous grafts or autogenous grafts. These are also called autografts. These grafts are taken from our own body in order to create a nasal structure, for example, cartilage, bone, and subcutaneous tissues. This is the safest and most effective grafting material used in rhinoplasty. Autologous grafts are resistant to the infection and trauma. They are easy to sculpt, not subjected to discoloration, readily available, and less morbidity of the donor site, making them the primary choice in rhinoplasty. Some of the complications associated with the harvestations of the donor sites are pain, pneumothorax, and tissue death. In an augmentation rhinoplasty, the grafts are taken from different parts of the body, such as septal grafts, which are derived from the nose itself, rib or costal graft. As the name suggests, these cartilages are derived from the rib or costal areas. Auricular or conchal cartilage. This is taken from the ears. Hard bones from the iliac crest of hip or rib, tibia, which is a leg, and from ulna, bones of the forearm. The grafts are further divided into two categories, structural and contour grafts. During the primary rhinoplasty or nose job, the cartilage is typically harvested from the nasal septum to make a graft. It is also called a septal graft. However, as the revision rhinoplasty with additional graft is required, the cartilage has to be harvested from the other body parts. It's because patient has inadequate amount of cartilage available. This is when ear cartilage, rib cartilage, hip, and tibial bones are utilized. A cadaver rib can also be purchased. I believe the surgeon might have used ear cartilage when Priyanka Chopra had revision nose job. Typically, the scars are hidden behind the ear and the fascia graft is taken from above the ear within the hair, so the scars are not visible. It is easier for the surgeons as well due to its easy accessibility, minimal risk of infection, and easier recovery of the donor site. But it can alter the shape of the ear or result into some irregularities in the contour of the ear. Again, it really depends on the surgeon's skill. The ear feels slightly softer from where the cartilage has been removed later on. Can you see those irregular contours on her ear as well as the discolored scars from the stitches? She might have used this graft to treat her nostril defect, as she has retracted nostrils. Ear cartilage is not preferred for a surgery requiring major changes, as it is soft and curved. Therefore, for the tertiary rhinoplasty or to achieve the bridge of the nose she has now, I believe she had a rib graft. Ear cartilage is too weak to use as a structural support to build the bridge she has now, or to augment the dorsum she has now. Also, it appears like she might have had an ear reconstruction surgery as well. Looks like she had ear pinning surgery or macrotica surgery, which is also called an ear reduction surgery. In this surgery, the upper portion of the ear height is reduced, placing a scar inside the helical rim, which is usually not seen. See how in her before pictures, the top of her ears are usually hidden inside her hair. Let's talk about rib graft now. Rib graft, due to its abundant supply, is often a choice of material for the patient with major deficiency of cartilage. With multiple rhinoplasties, PC might no longer have any nasal septum available for grafting. Hence, rib graft seems to be the best option for her. Rib cartilage is resilient, and this characteristics provides an enormous amount of support for the reconstruction, as well as it can provide larger changes to the appearance of the nose, as you can see in the picture. There is no substitute for the rib cartilage in terms of length, strength, straightness, and the abundance. This cartilage is harvested from 5th, 6th, or 7th rib. A small incision is made under the crease of the breast for a female and right over the most prominent part of the cartilage of rib in the male patient. The incision is small enough to be hidden under a bikini. The cartilage is then carved meticulously by a surgeon. This prevents the cartilage from warping. The downsides of the rib cartilage are its variable reabsorption, unexpected warping causing the nose to be misaligned, and the visibility of the sharp edges from the thinned out skin over time. Some surgeons use gear wire to anchor the graft in order to prevent the warping. Also, it has a tendency to give a very unnatural operated look with sharp edges showing through the skin and may feel stiff. I'll talk more about the complications of rhinoplasty on my next video. Till then, thank you so much guys, and please let me know if I need to make any changes. Since this is my first video, I'll need a feedback from you. Thank you.